Alternate nostril breathing is a wonderful way to prepare for your cesarean birth. If you have a scheduled cesarean, if you have a TOLAC or a trial of labor after cesarean and you're hoping for a VBAC birth, but you would like to be prepared for the event of possibly a repeat C-section, or even if you are not planning on a cesarean birth at all, alternate nostril breathing is a really powerful tool to practice during your entire pregnancy to help with your pregnant symptoms, maybe prenatal anxiety, if you're having some big feelings about birth coming up, if you are wanting to prepare to breathe through contractions and to get yourself through labor, alternate nostril breathing is for you. It balances the two hemispheres of the brain. It helps to reduce stress and anxiety. It also helps to lower a heart rate. It also helps to regulate blood pressure. So there are some scientific reasons behind the powerful practice of alternate nostril breathing, not only for pregnancy, but to prepare you for birth and while you are in labor or while you are preparing for your cesarean birth. So there are a few different variations that I've seen people practice. This is the one that I practice with my clients because I find it is the easiest one to remember. So we're going to take our hand, right or left. If you're a righty, you'll want to use your right. If you're a lefty, you'll want to use your left. And we're going to close a nostril with our pointer finger and with our thumb. So you're going to be closing off one side of your nose as you inhale through the other, closing off the side that you've inhaled, and exhaling out the other side. Inhaling, closing off, exhaling. Inhaling, closing off, exhaling. So we're going to go back and forth like that for 10 rounds together. And then I suggest you practice this every single day for 10 rounds, which will be about a minute in length. And you can do it in the morning, you can do it in the evening. It's a great way to not only help kind of wake up your brain, but also calm down your brain. So it really has a ton of benefits. So let's start with taking a clearing breath in through nose, out through mouth. Taking our hand, inhale through right, close, exhale left. Inhale left, close, exhale right. That was round one. Close. That was 5. Let's do 5 more.
Last one.
Clearing breath in through nose, out through mouth. All right. So I said each breath took about a minute. So it's about a little more than a 5-minute practice for the inhale on 30 seconds, 30 seconds, 30 seconds, 30 seconds. Each side is about a minute total rounds. So the total breath practice, if you do 10 breaths, is about 5 minutes long. So you can make it shorter if you don't have 5 minutes. If you have 2 minutes, do half as many breaths, do 5 breaths. And again, try this breath every day if you can. When you wake up, schedule a few extra minutes to wake up early and try this breath before you begin your morning routine. Try this breath at the end of the day. If you're a little congested, try blowing your nose before you do the breath. And if you cannot breathe totally out of one nose, out of one nostril, and it's uncomfortable, you might want to skip it that day. That's fine too. But you can continue doing the deep breathing in its place if you're congested. That has a lot of benefits as well. But that alternate nostril breathing can be so helpful prior to your cesarean birth, prior to your whatever type of birth you decide to have. But it's especially helpful during that cesarean birthing because as we kind of lose the mind muscle connection from the medicine that we're given from cesarean birth, it helps us to maintain our peace, our calm. It kind of prevents your brain from freaking out and going, oh my God, I can't feel my chest, I'm not breathing. You are breathing, and this breath reminds you that you are. Thank you for joining me. My name is Jessica with Mama Shakti Prenatal. Mama Shakti means Mama Power.